Hello, hello. Going live. Hello. Who's watching? Just waiting for a little bit for people to get online so they can start asking questions. Let's see, how does this work? Okay. How does this work? Let's see here. How do you see? Alright. How does this work? Alright, sorry about this. I'm kind of new to this. I can't see any comments to see if anybody's commenting. I see 4 people. Just wait a moment while I get everything set up. How does this work? Hello. Who are you? Hello, Ree. Okay. I'm just waiting a little bit for more people to come on, and I'm trying to figure out how to do this live thing. So this is the first time for me. If you have any questions, I think what I'm gonna do is I'm gonna end this live feed and then try to put it a little bit more straight up. Maybe I'll be able to see who is watching. So I'm gonna finish this and then go back alive again. I will be right back. I'm gonna end this live feed and restart it so that I can see if anybody messages. I see there's like 2 people. Man, how does this work? Hello, everybody. Let's see here. Does anybody have any questions? Nobody has any questions yet? All right. Let's see here. Hello, everybody that's coming on right now. Hold on one second. When you go live, do you see words on the side or what? Because I put it to the side like this. Because you've gone live before, right? Hello, hello. How you doing? I'm just trying to figure things out right now. Facebook. All right. How to get... Hello. All right, I apologize. I'm just trying to figure everything out. This is all new to me. I keep repeating myself. But if any of you have any questions, feel free to ask. Otherwise, I'll just start talking about a few things while everything starts settling in. So I'm here today because I'm just trying to clarify about what is chiropractic, how can it help, and any kind of concerns about any conditions you might want to ask. I'm here to answer all of that. I'll be here for a while. So first off, what is chiropractic care? Chiropractic is basically, it is a profession that focuses on finding and locating subluxations or misalignments. That basically means we look at bones and joints that are not moving properly and we align them. We do not treat medical conditions. Therefore, we are not medical doctors. So what we do is we just treat misalignments and that's it. Now, if you have any questions about, say, scoliosis or low back pain or migraine headaches, feel free to ask and I will answer your questions. So I'm waiting for the very first question to take place. Does anybody have a question? Okay. Hello, Vinny. How are you doing? Hey, what's going on? All right. Let's see. Anything else? All right. We got like 8 people on here. Wow, this is really starting to pick up. Good. I'm really excited. Today is going to be an awesome day. Later on, towards the end of the live feed, I am going to be offering a gift. So it's going to be something that is tasty and I will be sending it to you. I'll be sending some nice, I'm going to be giving away puto puffs made by my wife. Puto puffs. Best things ever. It tastes really, really good. And if you've already tried it, you already know how good it is. So, let's see. Yes. I already saw that, Janelle. I've been telling everybody hi for a while now. Let's see here. Oh man, this is a slow start. Let's see here. Can everybody hear me pretty good? Good. Excellent. Now, do any of you have any questions? That's why this is a Q&A to understand how chiropractic can help you. Wow. Okay. All right. So, I guess I'll just talk about some stories while I'm just waiting for someone to actually ask me a question. How can chiropractic help you? Say a person does not have any symptoms whatsoever, no pain, nothing. Can chiropractic help you? Yes, it can. Chiropractic is not just for those who have no symptoms. Chiropractic is for everybody. Why? Because chiropractic helps get bones moving whenever there's restrictions. Now, there are 2 main causes of misalignments. That is 1, poor posture. Number 2, stress. Physical, chemical, and emotional stress. These 2 things cause muscle tightness. They cause restrictions on the joints. So if a person doesn't have symptoms, it's okay for them to get checked. All right. Hello, Mike. I'm just now seeing your message. Okay. I'll just testify you've helped me regulate my blood pressure. You corrected alignment on my neck. My blood flow is now better than ever. Yes, that is awesome. Now, I know I'm getting away with what I was saying earlier, but I want to clarify what he was talking about, what he means by that. The body has the innate ability to heal itself. It needs no interference, and interference consists of misalignments. Now, if a person has blood pressure, chiropractic does not cure blood pressure. What it does is it alleviates the pressure that leads towards high blood pressure, and the body heals, and therefore the blood pressure begins to go down. Now, in 2007, there was a research that was done where there were a lot of patients that had high blood pressure, and they were separated into two different categories: those who received chiropractic care, and then those who did not receive chiropractic care. And it was shown that one chiropractic adjustment is the equivalent of two of the strongest high blood pressure medications given in combination. Now, this was proven in 2007, but again, like I said earlier, is chiropractic does not cure blood pressure. It just allows the body to properly heal the right way. Chiropractic it's not about getting you to instantly feel better or anything like that. It's getting you to heal right. Now, as far as alignment of the neck, yeah, that's one of the best things ever. When the joint is properly moving, everything is happy. All right. Cute. Ask. I'm trying to get everything set up on YouTube. All right. All right, let's see here. Is there anything you guys would like to hear about? No, it should be public. Hold on. I'll make it public. There you go. It is public. Sorry, I think I had it on limitations. Alright, connect streaming software. Alright, I'm going to try to do this every week. So, okay, Facebook friends. Oh no, it's available. It's public right now. I have it public. Alright, so my name is Dr. Jon. I'm working out of Alabang as a chiropractor at Doc Rob's Chiropractic Clinic. I'm doing this to help spread the knowledge of chiropractic to everyone across the Philippines. I'm open to any kind of questions, whether it be difficult, easy, or whichever. I am ready for any question. So feel free to ask away. So I will ask here. Let's try to make things a little fun. So if anybody, what I'm going to do is I'm going to ask some questions, and whoever answer these questions and they get it correct, they will get a prize. Okay? So the prize that I'm offering is puto puffs, the most delicious putos you've ever had in your life. So the very first question is this. When you answer it, I want you to say, just like what I've heard before, me first, and then the answer. The question is, how many bones are there in the human body? Ask away. Hello, Eric. What's going on? What's going on, buddy? Yes, it's true. Yes, it is the best. That's right. All right, let's set up. All right. Me first, 206. Wow. Well, it looks like you want some more puto, don't you? That is correct, Vinny. 206. Ah, Sayang, Eric, you missed out. Somebody already beat you to it. I'll do another question later on. And I'll give some puto to them too. All right. Now, is there anything that any of you guys would like to have clarified? Any kind of question that's dealing with health? Well, it looks like this YouTube thing is not quite as easy as I expected. Apparently you need a software. It's all right. Yes. Does anybody would like to know about how chiropractic first started? Is anybody interested? All right. Biology. Hello. Oh, yes. Cool. Awesome. Biology. I love biology. What chiropractic can do for scoliosis? Ah, okay. Yes. Hi. All right. How can chiropractic help? What can it do for scoliotic patients? Well, first of all, understanding of what scoliosis is. Scoliosis is the abnormal curvature of the spine. Now, there's three parts of the spine. There's the cervical, there's the thoracic, and then there's the lumbar. Now, what happens with the scoliotic spine is the bones tend to rotate. Usually they rotate and they bend, or they bend and they begin to just kind of curve off away. What a chiropractor does is we look for specific bones that are the ones that are stuck. Now, there's two types of scoliosis. There is postural, and then there is genetic. The genetic one basically means that sometimes the bones tend to develop a certain way, and it causes the spine to adapt and change. Now, there's hemivertebrae, meaning like where the bones are square and the one above goes up and angles over. The spine will go over that way. Then there's where the bones are fused together and they are one and they don't move properly, so the spine tend to accommodate to that. Now, that is genetic. Now, postural has a lot to do with poor posture. So, the posture scoliosis can be helped very easily. So, you just have to find which is the one that is not moving properly, and then help that person learn how to have a better posture. Now, as far as genetic, you can only help to a certain extent. So what a chiropractor does is they palpate and then they de-rotate or adjust that spine so that everything can mold into that position, and everything takes time. There's no such thing as a magic bullet where things heal right away. Yes, Mike. All right. Let's see here. People my age are afraid to have chiro sessions. Please explain why they should not be afraid. Great question. Thank you. Thank you, Mike. Now, chiropractic is for any age. It does not matter how old a person is or how young a person is. It's understood that a lot of elderly people tend to have decreased bone density, but that is not something that should keep a person from going to a chiropractor. Now, a chiropractor tends to use a different kind of pressure based on per patient. You know, nothing is done the same every single time. So, for example, if a person has decreased bone density, a chiropractor would use less pressure. Now, my oldest patient that I've ever treated was 95 years old. This patient had severe arthritis, had some decreased bone density and everything like that. We have techniques and we have tools that allow us to treat that person regardless of bone density and how old they are. Now, the way we do things is we do things differently with an older patient compared to someone who's young and everything like that. We do the same thing with babies and how we do it. We do it lightly. We do it with limited motion. See, motion is life to joints. So when you constantly get motion into the joints, it heals. Now, the biggest reason why an older person should not be afraid of chiropractic care is chiropractic is safe. You know, chiropractic's been around for more than 100-something plus years. We've changed and modified techniques and ways of doing things so that we get motion into the joints. See, the worst thing that a person can do is sit there and do nothing. We're meant to constantly be moving. It's very, very important. Now, side effects of chiropractic care are addictiveness. So that's something that should be taken into consideration, understanding that it feels really, really good. The thing a lot of people are afraid is because they see things on TV and they think that the bones are going to break when it's not. All right. Hopefully that answered your questions in many ways, Mike. Any other questions? Yes, that's a good one. Yes. Can chiropractic care help pregnant women? And that right there is a very big yes. When a woman is pregnant, one of the biggest things that she has is low back pain. In the second trimester, there's a hormone called relaxin. Relaxin causes all the ligaments all throughout the body to become loose so that the pelvis and everything can change to allow room for the baby in the uterus. So headaches are very common because the weight of the belly is leaving forward. Therefore, there's a lot of pressure on the low back. So chiropractic is something that is really, really good to help with all these tensions that take place when a woman is pregnant. It also makes the birth much easier, labor much easier, less pain, easier to recover. Not for me. I'm not afraid. It's okay. It's your personal choice. Any other questions? All right. All right. How about this one? How about what? Hello, Karina. How are you? What are you trying to ask, Karina? What's your question? Let's see here. What? Okay. There's a grade 2 antherolisthesis of L5 over S1. Yes, Karina. Chiropractic can help with that too. I've had many patients that had a antherolisthesis where L5 basically shifted forward. What we do is we put it back into the position in place, and then recommend that person wear a lumbar sacral support to help stabilize the area while the body heals. There's a law, a physics law called Wolff's Law, WOLFF''S. What Wolff's Law states is whatever pressure load is placed upon the bone of a healthy person, it will cause that bone to remodel itself on the inside and the outside. So bones tend to remodel, they shape like clay. So whenever we're doing our chiropractic care and we're dealing with these certain conditions, it does help. It takes the pressure off the L5, L, and S1 nerve, which takes away a lot of pain and tingling and numbness, not like going down the back of the legs, the side of the legs. Hello, Ed. How are you doing? Miss having chiro with you. It's okay to do chiro prior to playing basketball or any sports, or better after? All right, great question. Thank you for that. Yes, chiropractic is very good before playing sports or playing after. It's great for the recovery. It cuts the recovery down in half. Let's see here. So the thing is, if you look into history, one of the biggest sports players like Michael Jordan, he received a lot of chiropractic care, and it helped him very well while he was playing for the Chicago Bulls. So that should be an answer. Tiger Woods is another one. I mean, there's so many people who receive the benefits of chiropractic care to help them be at their optimum. How chiropractic can help with those who play sports is it allows the joints to move properly. It allows the joints to heal much easier. It allows a recovery time to be split in half. Let's see. Hello, Dea. How are you doing? Let's see here. Hey, you've gone live. That's great. What you're doing. Some people don't know what chiropractic is all about. Great job. Thank you, Mary. Hello. Sorry I'm a little late on replying. I'm just focusing on the questions. Anybody have any other questions that you would like to ask? Yes. Wow, 15 people. Not bad. Super busy. All right. Hi, Kenneth. How you doing, man? What's going on, buddy? All right. All right, all right. Hey, Anna. How you doing? Good afternoon. All right. You guys have any more questions before we wrap this up? Because I've still got a lot to learn about all of this going live stuff. I think I'm gonna do this again next week, and maybe we'll throw in a game of strawberry filled puto. Sarap. Again, we're gonna be giving away a tub of my wife's delicious, famous puto. I'm going to be doing a question in about a few minutes, and I'm going to be asking a question, and hopefully one of you guys will give it right. He'll be beginning with me first, and then the answer, okay? Let's see, I see some questions. All right, I have a knee injury. It drains some water. Will chiro help? Thinking chiro is mostly upper body. Thanks. Yes, Ed. Now, no, chiropractic is not only about upper body. It's about every single joint in the body. Anytime you get a joint that does not move properly and becomes inflamed, it swells up, and then you get fluid in there, and that right there creates pain and other symptoms, numbness, tingling, everything like that, especially when a nerve gets involved. Now, how can chiropractic help with the knee? Many different ways. What chiropractic can do is help induce motion into the knee that is not moving properly. The following recommendations is using cold compression. Cold compression reduces inflammation. That right there helps you feel better while your body regenerates, because your body does that. It has the innate ability to heal. Mike, no, chiropractic is not only just for those who have problems. It's for everybody. If you just want to move better, like saying walking, running, jogging, playing basketball, playing badminton, it can help because it gets motion into the joints that are not moving properly. Again, like I said before, there are two very common causes for misalignments. The very first one is poor posture. How you're sitting, how you're sleeping, how you're sitting, things like that. Then there is stress. It's physical, chemical, and emotional stress. You cannot get away from stress. That's why chiropractic is not just for those who have symptoms. It's for those that have an everyday active lifestyle. It works. Of course, don't put hot compress. Put yellow, put ice, cold compression. That right there is what's going to help you. I'll show you what I mean by cold compression. What happened to our cold compression pack? Okay, apparently I've run out of cold ice packs. All right. Cold compression, yes. Yes, it should be cold compression when you put it on your knee. If you put heat or hot compress on a joint that is inflamed, you're only going to make matters worse. It will increase the blood flow to the area, therefore it will slow down any kind of healing whatsoever. So when it comes to joints, you want to put cold compression, never heat. If you want to loosen up a muscle, then yes, hot compression is the best thing for that. All right. Is chiro good for babies? Yes. See, children have things that happen to themselves too. Children fall, they trip, they are born in specific ways, pulled out by their heads or their necks. So yes, chiropractic is great for babies, especially those that have middle ear infections. Colicky, babies that consistently cry all the time for no reason. Whether you change their diaper, you fed them, you've burped them, chiropractic is great for that. All right, what is your comment for those who say chiro is good? They fix their spine, but after you will move again and you will return to the previous alignment. Okay, Ed, the answer to your question is that person was not consistent with the chiropractic care. Typically, it takes anywhere from 4 to 6 months for things to regenerate and to move properly and to stabilize. It takes time. Nothing happens overnight. There's no such thing as a magic bullet. How often should a baby get adjusted? Okay, so how long should a baby get adjusted? It all depends on the problem. The more severe it is, the more often that baby gets adjusted. Once things have regulated and become normal and they're no longer suffering, then you can do maintenance like once a month and once every 6 months, things like that. Hey, Peter, what's going on? Long time no see, buddy. It's good to see you online. Thank you. Thank you for watching. All right, is there any other questions? What's going on, Tony? Anton? What's up, brother? All right. Good times. All right. Do you have any other questions? Otherwise, I'm going to assume I've done 32 sessions with you. It's okay now. Okay. As far as maintenance-wise, well, that all depends on how you want to do this. Like if you just want to maintain things, you can do twice a month. You can do once a month. It all depends on your schedule. Because again, like I said, chiropractic is a lifestyle. It's not something it's for only when you have symptoms. Chiropractic it's like dentistry. Every 6 months you get your teeth cleaned to maintain it, so that you don't get any cavities. What you do at home, how you do that stuff, that varies, and how it helps you in your life. Any other questions? Now, as a chiropractor, I've been receiving chiropractic care for a very, very long time, even before I decided to become a chiropractor. When I was in school, when I was in college, all of us students, we would always adjust each other. We would always practice, try to perfect our technique, before we got to clinic. Now, once we got out of college, our backs, our neck, everything was jacked up because, whenever you're practicing, you're training, we would hurt each other sometimes, and sometimes we would get better. But when we got out, we would go to those that were already practicing for a while, and when we would get corrected. So it took about 5 years for all of that to get reversed. All right. Thank you, Ed. Awesome. All right. Now, does anybody else have any questions? All right. If nobody has any questions, what I'm going to do is I'm going to ask one more question, and then we will end this live feed, and we'll do this again next week. Let's see right here. What does it mean when either of your shoulder is in pain? What do you mean by shoulder? These are simple muscle. Okay, never mind. I understand your question. Well, that could be several things going on. If either of your shoulder is hurting, it can be because of several reasons. First one is poor posture, slouching. When you're slouching, going like this, your shoulder is in flexion. So that means that you can no longer lift up right here. So the muscles are always constantly firing because they're stabilizing it. to make sure there's the proper amount of support. Another thing that can be happening is a bursal sac. There's a thing inside called the bursal sac which creates lubrication that allows things to move properly. It lubricates it. That right there can be inflamed due to, lifting up too many things in a bad way. It can be instability of your shoulder girdle muscles. It can be because of being on the computer or cell phone for prolonged periods of time. It could be how you sleep. People sleep like this, or they sleep face down. I mean, there's a plethora of reasons why the shoulder muscles would be hurting. And another one is overexertion, maybe lifting up something a little bit too heavy at a given time. And the muscles being so tight, they're pulling on the shoulder and causing pain. Because there are pain fibers in the muscle tendon, in the muscle fiber itself. So if anything kind of tears or stretches too much, it can be irritating. Hopefully that answers your question, Mab. All right, so for those who live here in the Philippines, I have one last question. We're going to be giving off another 6 pieces of puto puff. So when you answer this question, make sure you put me first. In your own words, I want to look for the best answer, actually. That's what I want to do. I want to ask a question, and I want each and every person to answer it, and the best answer is the winner. What is... How can I... What is chiropractic to you? In your own words. That's what I'm going to be asking. And the best answer will get puto puffs. So, let's get it going. Alright, so while people are going to be thinking of their answers, I'm going to answer a question right now. Can chiropractic help you lose weight? And that right there is a big no. Chiropractic does not help you lose weight. Losing weight has to do with dietary food, what you eat, how active a person is. But 85% is dietary, what you eat. But in a certain context, it can help you. If a person is in constant pain, they can't really exercise, and stress causes a person to gain weight. So, if a chiropractor adjusts a person and they have less pain, yes, they will begin to move and they will start exercising and they will begin to lose weight. So that's a good way to answer that question. Just guessing. Muscle and joint healing. Nice try, Mabs. Nice try. Alright. I'm going to be closing off the polls in about 2 minutes. Waiting for someone to actually answer the question. What is chiropractic to them? Alright. 1, 2. Skip a few. Alright. Well, since nobody wants to answer, I guess I'm going to be having to end this session. Alright, so we'll just save the other part for next time. I appreciate everybody for participating. Thank you so much. And please have patience while I try to learn how to use live on Facebook, because apparently I'm not doing it correctly because I can't see comments on my cell phone. I can only see them on my laptop. You guys have an awesome day. Thank you so much for coming. God bless. Be safe, stay cool, and stay hydrated. Have an awesome day. Thank you.